Hello, viewers. Hope you all are fine. Today, I want to tell you about something special, which is very important and has a critical importance in the medical field, and you can say related to human health. And when the, especially when the human health is in a critical condition, that is called the pulse oximeter. And this is that one which I want to show you and tell about it. This is, you can say, an instrument that tells us about the oxygen level in the blood of the human body. That is a very vital requirement for a normal human body, and when it is suffering from some illness, and when the life is in danger regarding any illness. And the second thing which it tells about is the pulse rate. That is also very important. And all the health facilities, which may be big or the small unit, should have kept this instrument. It can also be kept at home so that if any, especially elderly patient or especially the any other patient of any age, the illness regards to the respiratory tract especially and the cardiac involvement, it will help a lot in that condition. I'll show you practically how it works, and you will get to know its importance and how it is used. I'll show you also. So we go for it. How it works: we press it from one side like this. Hope you all see it. And then we put a finger in it. Any finger you can put like this. And then we press button. The press button is on one side of it, and we press button, and it will tell about the oxygen level in the blood. And I show you the oxygen level and the pulse rate. Here you can see. This is my oxygen level is 99%. Wow, it is very good. It shows that very good level. And the pulse rate is 125, a little bit higher. Yeah, because of the excitement and the hesitation during recording this video. Yeah, but it should be the normal pulse rate should be between 60 to 100 per minute. Its counting should be, and the oxygen level it shows up to 100%. Okay, and if the oxygen level is between 80 to 70% down, you can say between 70 to 80%, it shows the critical level of oxygen. That shows that the person or the human or the patient needs immediate medical help. Okay, and it also tells the pulse rate. If the pulse rate is below 60, that is noticeable, and if it is nearly about 150, that should also be considered at a critical level. And everyone should have it at the health facility, and if you can keep it at home, that is also very good. Because if someone gets critical symptoms like unconsciousness and you can say the respiratory difficulty or the suffocation, and it would help a lot. You can put it like this on the finger and measure its oxygen level and the pulse rate. It would immediately, at the spot, you can say instantly, tell you about the condition of the patient. And if all the paramedics and the medics and the doctors and even any layman who has no relation with the medical profession can keep it at home and use it like this. Okay, I turn it off now. It is enough that you have viewed it and you have got the main lesson from it. Okay, and it is as important as you can say the blood pressure apparatus, which is called BP apparatus in the daily language, and stethoscope. As much as these are important, this is also important like this. If you have it, it is not so much costly, and it is portable. It is of portable size. You can keep it in your pocket, and you can use it in first aid also. And this is very important, especially the heart patients, the COPD patients, or I mean who have bronchial asthma. And it means this is the medical terminology. I can tell you about these in easy language. You can say the persons who have the medical problems regarding heart and lungs and breathing, and it would help in these conditions especially. Otherwise, it can be used in any critical condition. When you see any person in daily routine life at home, in any medical unit, any medical facility, it would help a lot, and it would help you decide instantly how much critical condition is that on the spot, and you can help the person accordingly, and you can give treatment at the spot accordingly, and even you can refer that person or the patient to the health facility. If these two things are normal, it shows that oxygen is good and the pulse rate is good. If it is normal in the normal range, then it should be somehow satisfactory if these two indicators are normal, along with the blood pressure and the other signs. But this is not the wholesome indicators. Okay, you also have to assess the clinical condition of the patient or the person with other signs, symptoms also, uh, like the vital signs: blood pressure, temperature, respiration, heart rate. All these are critical signs which are called the vital signs. Along with that, you should use this. Or if you have only this, it would help you a lot. I hope you have got a good lesson from it. It would help you in the daily life, and it would remind you of its importance. Thank you very much. Take care. Thanks a lot.